we're going to give Osa Tui the floor for some opening remarks. Osa.
Aloha. I'm Osa Tui, president of the Hawaii State Teachers Association, and I'm glad to be joined by my fellow public sector union leaders this afternoon. With regards to HSTA, teachers for the most part have taken advantage of the opportunity to be vaccinated, and we've encouraged our members to get vaccinated if they haven't already. Indications from the Department of Education were that teachers are around 80% vaccinated as of a month ago. Remaining employees, however, have medical, religious, and personal reasons to not get vaccinated, including the fact that the current vaccines only have emergency authorization and not full approval just yet. We're told by the Department of Education that it's perfectly all right to have our schools open with children who are not vaccinated, and that schools are safe because there are strict protocols and core essential strategies and additional mitigation strategies being implemented. However, Hawaii continues to have a teacher shortage crisis. The DOE says it's especially important that schools remain open because students need their teachers. Worryingly, this might cause more of our educators to leave the profession, which will leave even more of Hawaii's keiki without a highly qualified teacher. Many questions remain about this new proclamation with regards to the logistics of testing, especially for those in our rural areas, that we hope to resolve with the state through impact bargaining, and we stand ready and willing to meet immediately to negotiate these impacts. Mahalo.
Thank you, Osa. Osa and the other union leaders will be available for your questions now. And we have our first person wanting to ask a question is Rick Desog from Hawaii News Now. He says the question is going to be for all four. So Rick, why don't you unmute and take it away?
Right. The governor said that, to quote him, he says, I think that every employer, this is regarding exemptions. He mentions he thinks that every employer will be implementing the vaccine requirements as they believe is appropriate for their county or their employees. Some will be specific with the restrictions and others will be treating it differently. It sounds like he's leaving it up to the counties to define what they mean by medical and religious exemption, you know, what the policy is. Your reaction to that? It doesn't seem like there's a strict exemption, statewide exemption.
I think, Rick, you know, this is one of the issues that we're most concerned about, that we had, as Osa just suggested in his statement, would look to impact bargaining to address. Things like exemptions should be uniform, because the courts are going to rule on this exemption question perhaps at some point, and their ruling would apply to everybody. So for the governor to take the position that each jurisdiction will be able to do what they want, in a sense, is just counterintuitive and frankly not wise leadership. But there should be consistency as to how these exemptions are defined and developed. So there's no question that if it's a religious exemption for somebody in the county of Maui versus somebody that worked for state government, it's the same criteria that would be utilized.
Any other leaders want to react to that?
What I want to point out is for the university system, for example, if it's left up to the counties, that would mean that faculty on different islands would have different, perhaps different requirements. And that would apply to HGEA, HSTA, and UPW as well. So that's not the direction that we would want to move in. We want something uniform that would apply to everyone. Thank you.
Anybody else before we move on? Liz?
Thank you. You know, UPW represents 13,000 state and county employees across the state of Hawaii, and they'll be significantly impacted by this mandate. And while I was listening to the governor's press conference today, you know, I had the same concerns as expressed by both Randy and Christian. There needs to be consistency, and there's just a lot of confusion right now as to what's going to be going on, what the rules will be. So, you know, we're committed to discussing and bargaining this mandate with the state and counties to ensure public employees are treated fairly.
I think
Yes,
for all of you guys, just to echo what Liz said, you should know that before we got any word whatsoever from any employer, starting with Governor Ige, we collectively, the unions, met on Monday, and we approached the state's chief negotiator expressing our willingness to move forward with this idea of pushing vaccinations and something akin to a mandate, if you will. But we had done so with the expectation that we would be able to negotiate the details of how this would be carried out. This is all about the public health. We understand that, and we are all committed to do what we can and continue to encourage our employees that we represent that getting the vaccine is in the best interest for all. There are, however, as Osa pointed out, different reasons, be they medical, religious, or personal, that some individuals may not seek the vaccine. And in those instances, we were prepared to work with the employers to somehow find a way to address those issues. It's sad that here we are expressing such willingness only to see the governor and the mayors today take a hardline position, take this or leave this. Your job can be threatened if you choose not to get this vaccine. It's a most unfortunate circumstance when we had already expressed the willingness to work with them.
Yes, and on behalf of our members, we have a bunch of questions, and it seems that when the reporters were asking questions as well, they didn't have answers. And that's often what happens when we discuss things with the state. They come out with something and then they don't have answers to the questions. They haven't fully thought through things before they go ahead and release them. And so that is very concerning.
Okay, thank you. And next we have Manolo Morales from KHON2. He has a question also for everybody, I think. Hi, Manolo.
Hi. I'm sort of getting the sense then is the general feeling you're not against the mandate per se, but you wanted some say on how this would be implemented and be able to, negotiate it with the state and the counties. I guess is that the general thing the message you want to get across? And I guess I also wanted to know what would be your next step. I know like the Teamsters have already said that they plan to file a complaint with the labor board. What would be your next step from here on? If you could answer that earlier part first, if you don't mind.
Well, hey, Manolo, I think for all of us, I guess I'm reluctant to get caught up with the use of the term mandate, because as it's being applied by the governor, it is an attempt to unilaterally impose something on the employees within his and the mayor's control. From the get-go, I think all of our organizations have supported the notion that as many people as are able and willing should be vaccinated, and we are not wavering from that position. We continue to believe it is an important safeguard, along with distancing and masking. All of those things really need to be employed for us to beat down in particular, beat down this very transmissible variant. But getting into this conversation about mandate, the way that the governor is imposing it, forcing employees, if you want to keep your job, you have to be tested at your own expense. It's very problematic and somewhat troubling to see how employee rights are being trampled, and at the expense of trying to get something done where we're willing to work together. Going beyond that, in terms of next steps, there's really been no communication with us. The communication has been at us, and in large part through you folks in the media. We don't have the document from the governor. So we cannot say specifically what is in his new proclamation. So for us, the first step for all of us, I think, will be to get our hands on the proclamation as it's issued and see exactly what the governor is restricting. Because there are rumors that the governor has increased the number of statutory restrictions. He made comment today that he has refined and they are providing more specific statutory restrictions. In particular to a question I think Darryl might have had about the UIPA, but we're kind of operating in the dark because there's really been no communication and no effort to do that. It's been pretty much top down.
You know, we have questions like, our teachers have second jobs, third jobs sometimes. When are they supposed to go and get tested? He also mentioned that, oh, insurance can pay. Well, some of the insurances will not pay for COVID testing. And so there's all these questions, you know, when are you going to set up? Dr. Char talked about, you know, we're going to set up more. When is that going to happen? Because they've set a deadline. And so are they going to be setting up these free testing sites and so forth and so on, so that members can go and get the tests in time before they lose their jobs?
Well, allow me to add too, you know, I thought it was particularly insulting to hear where, given the announcement by the governor today, you can have somebody go tomorrow to get the first phase of the Pfizer virus, and he or she will not be able to complete their vaccination process and will be subjected to testing at their own expense because August 16th is going to come around faster than the second shot. And that just shows that this group of employers really doesn't care about its employees. And I didn't hear I heard the governor and the mayors praise the community, but I don't hear any of them praising their workforces that have been on the job for all 6 of our organizations from the beginning of this pandemic and continuing to provide public service. And that's where, from our perspective, clearly, while we understand and support the public health issue involved, the manner in which it's being carried out is pretty insulting.
Okay, now our next question comes from Sophie from the Honolulu Star Advertiser. Sophie.
Thank you. Are any of you looking to take legal action in response to the vaccine requirements? You know, you don't have a lot of time. The governor has set a August 16th deadline. So is that something that's on the table? And if the vaccines were given full approval, which is widely expected, probably sometime in a month or so, is that going to change the, particularly for HSTA, I know Osa, you had mentioned that issue, is that going to change the game for you? Would you be more amenable to this mandate if that was the case?
You know, in terms of what we're going to do next, that's something we have to speak with our attorneys about, but it's hard to do that when we don't have the actual document, we don't have the actual proclamation in front of us to analyze. And sure, I think once the FDA gives full approval, I think there will be more people who get the vaccine, which is great. Anybody in the community who gets the vaccine, we absolutely support it. We've had a lot of vaccination clinics at our schools around the state, and we encourage more people to go.
Okay, next, Daryl Huff from Hawaii News Now.
Hi, my question is for Liz. What your organization represents prison ACOs as well as healthcare workers, a lot of people in hospitals and healthcare facilities. What are you hearing from members about this? It's been, out there for a little while. Can you give me a sense of how much of your membership is vaccinated and what kind of reaction do you think we're going to get from your membership to this?
I don't know exactly how many of our members are vaccinated. But I've been hearing from both sides. I've been hearing from those who are vaccinated and are saying that, they hope the union is fighting for them so that they can continue to work in a safe environment. And then I'm hearing from the other side, of course, asking what the union is going to be doing. I just wanted to address this mischaracterization by Governor Ige and Mayor Blangiardi, where they seem to think that we're just coming out and challenging the vaccination. And this is not the case. We've been reaching out to the employer to have discussions about this, but as Randy had said earlier, we've seen nothing. I mean, nothing has been sent over to the unions. No one has reached out to us to discuss any of this with us. So we're hopeful that we will have an opportunity to negotiate and bargain over what they are proposing.
Can I follow up though? Do you think that there's a chance that some of your members, particularly in the prison system, where we understand there's been a hard time getting vaccinations, will actually opt to quit or find something else to do? Do you think I'd even feel that strong?
Some of them may, and that's their right, their option to decide if that's the route they want to take. No one has expressed that to me as of today. So we're just waiting to see. I don't know.
Can I follow up with Randy or Osa? Do you think that these exemptions that were being discussed, it was all over the map in terms of, but most of the employers, most of the people under the employers are under the state of Hawaii. The governor is the employer. And have you heard anything from him about what the state employer intends to do when it comes to the exemptions? And what do you think would be appropriate if they did come down with something like what DOE already has for families on vaccination?
Unless the HSTA has heard something differently, I think none of us, frankly, Daryl, have gotten anything from this administration that would define the exemptions, identifying the process by which an individual would have his or her physician submit some kind of validation of an individual's inability, whether he or she is immunocompromised or what have you. There has been no discussion whatsoever about how one would characterize a bona fide religious exemption. And that's one of the concerns, and as pointed out by several of us during this conversation, it's that lack of clarity, that lack of consistency that frankly we were intending to address with the employers if they chose to engage with us as we asked them to.
But do you think that they did that? I'm sorry to interrupt, Osa, but do you think that they did that because they assumed that you would just throw up a brick wall? I mean, under the emergency orders, he technically doesn't have to bargain with you, right? I mean, he can impose something like this, but then isn't your real leverage on this at the grievance end and at the termination end?
No, I think one should read the law. If you read chapter 89-8, what you would find is that the governor would have the right in an emergency to suspend bargaining, but that is only if that bargaining would be an impediment to the implementation. And as I said earlier, we reached out to the employer, to the chief negotiator, before the governor floated this mandate conversation. So the governor was well aware of our willingness to work with him to come to some kind of agreement, if you will, and implementation. but they chose a different path. And the law would only suggest that if bargaining would be an impediment, and I will say this, the fact that they don't have details worked out, details are forthcoming, they don't have a plan. This is typical of this administration. They grandstand with an announcement, but they don't have meat on the bones. How is it then that trying to work with us over the next couple of days would be an impediment to meeting this August 16th deadline? But that's not the case. This is just an attempt by the employers to just top down and make themselves look good for the public at a time when we are not out of line with their thinking. We too believe that everyone as much as possible should be vaccinated. That's ultimately, we're trying to beat down the virus, and all 6 of us are of the same mind on that.
Daryl, you also wanted OSA to answer that question about the exemptions?
I was just gonna say,
yeah,
everything
thank
Randy
you.
said, same thing here. We're waiting to see.
That's good. Thank you.
And next we got Manolo from Channel 2. Manolo?
Thanks. And I guess Randy or anybody else, that's I wanted to make that clear. So is it something where what we're getting from the governor and the mayors was that they have every right to do this because this is an emergency proclamation, but or does this have to be done through collective bargaining? I mean, what is your actual position on that?
Again, without having the benefit of reading exactly what the governor is suggesting in his proclamation, there are circumstances clearly where, in the interest of a public, in this case, a public health issue, the governor would allow for himself broad powers. And this isn't on our part, this was never going to be about fighting with the governor and the employers, because I think all of the public sector unions, as I just said, are of the same mind. We all want to beat down the COVID virus, and in particular, this Delta variant. So we were never looking to posture ourselves to be opponents to what has to, in our minds, what has to happen. But at the same time, we have rights as individuals, as employees, and as citizens. And it's troubling to see that the governor is choosing, instead of a collaborative approach, the governor and the mayors are choosing a more confrontational approach, as if they have all the answers. And I think 7 years of this individual's administration have proven that this administration does not have all the answers. And for us, we were looking to collaborate to get to where we all feel we need to be. But sadly, that's not going to happen.
This absolutely impacts the working conditions of our members. And so we absolutely demand that there be impact bargaining to go along so that we can work out an implementation plan for this. Barring that, we're just up in the air right now.
We still have
Okay,
another
just-
question or two
sorry.
here. And I just wanted to note to you folks that you're seeing the leaders of 4 of our public worker unions in this state here, but actually there are 2 other unions that we're all speaking with one voice, and we're going to get a joint statement out later this afternoon. That's also SHOPO, that's the Police Officers Union, and the Hawaii Firefighters Association. We're going to get a joint statement out later this afternoon. The folks from SHOPO were in bargaining and unable to meet with us. Leaders from the Firefighters Union were also traveling and unable to be here in person, but they also send their greetings, and there will be a joint statement that we get out later this afternoon. Daryl, you had a follow-up?
If I may, though, before Daryl asks his question, Manolo, one other thing to add. This is a serious health crisis, and the governor is choosing to identify, or not, I shouldn't say identify, but to exercise rather his executive powers over the workforce. But he's choosing not to do that for the general population. And in reality, every one of us, whether we work for the public sector, the private sector, or what have you, we are all equally capable of being infected and transmitting that, or I don't know the right term, but we can pass it on to others. Even those of us who have been vaccinated can get COVID and pass it along. So I find it just a little disturbing that this is happening just to government employees, when in fact, the crisis is more widespread throughout our entire community. And I think questions that all of you guys asked of the governor would validate that it's not something that's being brought to us by travelers. It's being brought to us maybe by our returning residents. But this is a community-wide problem. And if it were that serious, then perhaps the so-called mandate should have been imposed on all citizens.
Okay, so I just want to make it clear because I don't want to state this incorrectly. It sounds like what you're saying is that you guys are not steadfast against a process where vaccinations for your members are required, or there's some conditions placed on them that require them to get vaccinations, but you wanted to be at the table to work it out.
Yeah, everybody's head's nodding there, but the answer to that question generally is yes, but I think because we have either because of religious reasons or medical reasons or personal choice reasons, I don't think legally, and this is America, we can't be compelled to get the vaccination. But yes, that for those who chose, or even if they wanted to, who cannot be vaccinated, then we all understand that there would be different conditions perhaps and different circumstances they would face. And that is what we were looking to bargain.
Okay, thank you.
Thanks, Daryl. And Sophie has a question for Randy Pereira from HGEA. Sophie.
You're muted, Sophie.
Sorry about that. I just wanted to start with my question for Christian because it was really kind of a follow to what Daryl was talking about. So University of Hawaii had come out, I guess a couple months ago, actually, with, saying that they were considering mandating the vaccines for staff at UH, for employees of UH. So this wasn't a surprise for UH or for your union. Can you describe those discussions that have taken place over, over the summer, and what positions your union has taken on the issue? Because UH never came out with that mandate, so I assume that the union was pushing back against it.
Thank you for the question, Sophie. To be clear, the university actually did not open any discussions with UHPA, and I'm not aware if they opened up any discussions with HGEA or UPW either about mandating vaccinations for the faculty or staff. We have been in discussions with the university about the reopening plans, and as a part of that, the vaccination discussion has come up because of the mandate for the students. Last week, I actually asked President Lasner if he would send something across the table for the unions to consider if the governor wasn't going to be taking any action, because it didn't appear as though the governor was moving on anything. So we've actually had some discussions. They weren't formal by any means, about what would be in the best interest of the university community with any type of vaccination mandate. But we were hoping that this was going to be coming either from the university or the governor, where we would be able to discuss the impact. And I can't reiterate enough what Randy and Liz and Ulsa had spoke to earlier. The six of us had been speaking with one another starting last week about doing some proactive outreach. And when we had our meeting on Monday, we were unified in our message that we are supportive of the vaccinations and public health. We simply wanted to make sure that we had a voice at the table. And it's clear that the governor and the mayors aren't willing to provide.
Okay, all right, thank you. Just, and then the other question I had for Randy, real quick, I just wanted to clarify, at the press conference today, EGAE had indicated that they were working really hard to make sure that there was free testing available for any government worker that was given an exemption or decided, or refused to get the vaccine. And I mean, there are testing sites throughout the state. I don't know what the status is right now. So could you clarify what you meant when you said that EGAE or the state is requiring government workers to pay for their own tests? Are you saying that there's some concern that testing isn't readily available, or could you just clarify what your concerns are?
Well, clearly, I believe there was misstatement by some in the press conference earlier today that insurance is covering. It is not. And I think the insurance companies are covering only for travel. At this point, there are concerns, as was pointed out by OSA. Rural area, the availability of testing is not the same as it would be here in Honolulu. Most certainly here, the free testing site, as I understand, is that the biggest one is at the airport where government employees can get tested. But are they capable of testing the volume of people that may be seeking it? And if so, what are the circumstances and the timing of doing that? So for them to say that they are looking to expand that, great, but we haven't seen it. And certainly we look forward to whatever kind of increased capacity for no cost testing that would be made available.
Okay. Any last questions before we wrap things up? I don't see anybody in the chat over there. And I wanted to know, Sophie has a question for OSA. Go ahead, Sophie.
Okay, yeah, thank you. I had one thing I wanted to clarify. I think that there was a news report earlier this week where a principal was talking about how he wasn't allowed to ask his staff or teachers whether, their vaccination status. I don't think it was that he was trying to out anybody or anything like that, but just try to get an overall picture of how many people were vaccinated. Is that any sort of issue with the union? I mean, has the union taken the position that schools can inquire about that? Could you, maybe elaborate on that issue? Maybe it's not a union issue. I just wanted to check.
Well, we're always concerned about the privacy rights of our members, and we're concerned that administrators at schools might not be holding that information with as much privacy as is required.
Okay, but so the union has taken the position that the schools cannot ask, is that correct?
We have concerns and we have questions that have not been answered.
Is there anything contractually that you think prevents them from doing so?
I'm not aware at this time.
Thank you.